Welcome back, everyone. We are talking this morning with Dr. Gazelle Anson, and we're talking about cosmetic surgery. Our phone lines are open, by the way, 735-DAY-1, 735-3291. We're discussing everything from who's a good candidate to who might not be a great candidate, and the position that these doctors end up being in, sometimes trying to make that decision and analysis. And this is a great chance for you to call in with any questions you might have. We're going to go to the phones because there's someone who's been waiting on hold. Connie, go ahead, please.
Hi.
Hi.
I'm 51 years old, and I'm developing that upper arm jiggle. And I just want to know what procedure, what they use, and the results of it. Do you have someone try and lose weight prior to that to see if they can develop that on their own? I'm just asking that.
Okay, thank you, Connie.
Well, the upper arm is a tough area, so you have to ask one of the toughest parts first. Because you have to analyze how much of that jiggle is due to excess skin, how much is due to fat. You can liposuction the upper arms, but you cannot remove you cannot tighten the skin with liposuction alone. So sometimes you can get away with a small amount of liposuction. Sometimes you have to remove skin, and there's a couple of procedures we do for that. Sometimes you can get away with a little small crescent in the armpit, and sometimes you have to do what's called a full brachioplasty, which is an incision that goes from the armpit all the way to the elbow. Now that's a big scar, and if people are doing it because they think they're going to want to wear short sleeves and they couldn't before, that's not a great option.
Okay.
So it depends on how severe is the problem. And the first thing you should be doing is exercising. Get those arms working and see what you can do with that first.
And it's interesting because when you mention exercise, people think you've got to go into the gym and start lifting, 50-pound weights. You can tighten some of those muscles up just swimming, that sort of thing,
absolutely.
walking with little light weights. JD, go ahead, please.
Yes, doctor. Do you do the S-lift procedure?
By that you mean the modified facelift incision?
Yes.
That's been around with some modification for many years. So yes, I guess the answer to that is yes with my own modifications.
For the rest of us, what exactly is that?
It's a way that a particular kind of small facelift has been sort of marketed with that incision. There are various procedures that go by specific names. They're really just a way to market a particular kind of incision. Omega, S, basically the goal is to minimize the incision, maximize the lift, and whether you do a mini, whether you do a full, whether you do a neck lift, sometimes you can get away with just tightening the structures without the skin. So really it's a very individual analysis.
Exactly. Okay, all right. Nicole, go ahead, please.
My daughter has raspberries on her face. She gets them, and sometimes they go away, and they kind of go out like a spider.
Yeah.
Is there a way to get rid of those?
Yeah. Yes, probably the best way is there's a particular kinds of laser that are very effective for those, as well as some more serious problems with the blood vessels like hemangiomas. And that's not something that I do personally. There are some dermatologists who do pulse dye laser, Krypton. There's a couple of good options for that.
Okay, 735-DAY-1, 735-3291, and I'm glad Nicole asked that question because I kind of wanted to talk about some procedures out there. Some are fairly new, some are very, very new, that have nothing to do with even have to go under the knife, so to speak. And one of them is the use of lasers. Everything from spider veins to, well, tell me some of the...
There are many different kinds of lasers. So when you say laser, you have to understand that there's many different kinds. So when I was talking about for the blood vessels on the face, that's a very specific kind of laser that you wouldn't use to remove hair. And there's a different laser used for hair removal or hair reduction. It's not exactly removal, but versus resurfacing for wrinkling and for sun damage. Those are all different kinds of lasers, and you can go to different depths. So that's...
I remember back, I don't know, many, many years ago, the only way to get rid of spider veins, which is a very common complaint, particularly in a town like this where a lot of people are on their feet a lot, servers and cocktail waitresses, that does not any longer involve getting injected with, I guess it was saline that they used to use. What is the recovery time for?
Well, I will tell you that I still think that for the blood vessels in the legs, the true spider veins, I still think sclerotherapy injection
Okay.
is still the gold standard.
Okay.
Laser is a reasonable alternative, but there are some pros and cons. And while I would recommend it for the face as the better choice, I would not recommend it for the legs as a better choice. It is a reasonable option,
Okay.
but not quite there yet.
Recovery time for laser on the legs is longer, isn't
Well,
it?
several weeks in terms
Yeah.
of the bruising, and
Right.
but that's true for injection
Oh,
as
okay.
well. In terms of how long it bruises, you still need to wear compression stockings for both types of procedures.
Okay, all right. Georgianne, thanks for waiting. Go ahead.
Yes, I was calling to ask about the eyes, particularly the upper eyelids. I have family trait, very droopy upper eyelids, and sometimes I actually feel like I can feel them,
Yeah.
which is
Yeah.
bizarre,
Yeah.
that I can sense that they're drooping on my eye. I don't think they obstruct my vision at this point, but so my question is, what kind of procedure you recommend, the recoup time, and some kind of price range for that kind of surgery
Okay.
in this area?
When you have fullness of the upper eyelids, that can be caused by two things. One is true excess skin of the eyelid itself, and the other is drooping of the brow. And everybody has some combination of those two things. So which is predominant on you needs to be evaluated by a plastic surgeon to decide what's the best combination. Do you need a brow lift or do you need a blepharoplasty? A blepharoplasty means taking out any ellipse of skin from the upper eyelids, and a brow lift means raising the entire brow up. Most commonly it's a blepharoplasty, but it depends. Everybody's different. That involves a procedure. Blepharoplasty involves it can be done under IV with local IV sedation with local anesthesia. About a week of severe bruising, possibly, sometimes up to 2 weeks. You should be able to cover it up with makeup by about a week.
Okay, all right. Thank you, Georgianne. Terry, go ahead, please.
Hi, I would just like to know if laser will remove freckles on my face.
It depends on how deep they are. Depending on what depth of laser you use, it can remove them or it can not remove them. So it depends.
All right, Terry, thank you. 735 day 1, 735 3291. There's been a lot of talk, I would say like in the last couple of years, about Botox.
Botox.
Thank God for Botox. Tell us a little bit about that, because people are squeamish as soon as they hear that it's botulism. They think,
Yeah.
oh, I'm gonna die. Tell us about Botox and where it's best used.
Botox just recently got approved by the FDA for cosmetic purposes, as everybody in the universe must know by now. I think that's a great thing. Botox is a wonderful product. What it does is paralyzes muscles that it comes in direct contact with. It involves a few small injections. It's very easy. It lasts between 4 and 6 months. It's best used for the frown lines. See? Okay.
we can't
So
frown.
when you're mad, you have to raise your voice. You can't let people know by frowning. And crow's feet. And it's not intended to remove every line. At least I don't like to use it that way. Some people like to have the entire brow free, but you don't want to remove expression. You
Right.
just want to make the wrinkles better. And same for the eyes. You want to just make it better.
And after you get the injections, it's actually a couple days before
Yeah.
it really takes effect.
It can take up to a week.
There's also, it seems to me, I've heard, that there's a kind of a residual effect even after the Botox wears off, since you have not the ability to frown, the line seems to vanish a little
Absolutely. And how well the line disappears depends on how deep that line is. But if you continue doing Botox, I've seen lines improve for up to a year. 'Cause once there's no muscle acting on it, it will relax. But if you let that muscle come back, it's just like a skeletal muscle like your arms. If you exercise it, it will come back.
And there's another substance, I don't know what to call it, something that is also very new, and it involves people who want fuller lips or they want to get rid of the lines in their lips. Tell us
Yeah,
about
that's Perlane or Restylane. That's a new product. It's made of hyaluronic acid. It is not yet approved by the FDA in the United States. It's been used in Canada and Europe, and it's very promising, but it still is on the order of collagen. It is an injectable. It is temporary. It probably lasts on the order of 4 to 6 months, something like that. I do like it, but it's not permanent.
But and the other good thing about it is it doesn't involve making an incision
Right.
and implanting
It's an
anything.
injectable.
Okay.